Hello everyone and welcome back to MediInsights. Today we explain Apresoline Injection, a fast-acting antihypertensive used in severe or pregnancy-related high blood pressure. I'll cover when it's used, how much to give, how it works, the side effects to watch for, and practical safety tips for both clinicians and patients. Starting with use of Apresoline Injection. Apresoline, whose generic name is Hydralazine, is used to rapidly lower very high blood pressure, especially when oral medicines are not suitable or when a quick intravenous effect is needed. It is commonly used in obstetric emergencies such as severe preeclampsia or eclampsia as one accepted option for acute control of maternal blood pressure. It may also be used in hypertensive crises under monitored conditions, but it is not always the first-line agent because responses can be unpredictable and prolonged in some patients. Next, dosage of Apresoline Injection. For adults, the typical intravenous bolus dose used in acute settings is 5 to 10 mg given slowly, which can be repeated every 20 to 40 minutes as needed while monitoring blood pressure and heart rate. Some protocols start with 10 mg intravenous slowly and allow cumulative initial doses up to about 20 to 30 mg, and continuous infusion regimens exist for sustained control, but exact regimens vary by guideline and clinical context. In obstetric severe hypertension, many guidelines recommend 5 to 10 mg intravenous every 20 to 30 minutes until target blood pressure is reached, with careful maternal and fetal monitoring. Dose adjustment is required for age, body weight, renal function, and clinical response, so dosing must be individualized and given by trained staff. Next, mechanism of action of Apresoline Injection. Hydralazine is a direct arteriolar smooth muscle relaxant that lowers peripheral vascular resistance and afterload. The drug appears to interfere with calcium handling in vascular smooth muscle and may inhibit IP3, mediated calcium release, and it can increase vasodilatory signaling such as cGMP and open certain potassium channels, producing arteriolar dilation. Because systemic resistance falls, the heart may respond with reflex tachycardia and increased cardiac output, which is why monitoring and sometimes adjunctive therapy are needed. Next, side effects of Apresoline Injection. The most important acute adverse effects are hypotension and reflex tachycardia, which can present as palpitations, headache, flushing, dizziness, or chest discomfort. Nausea, vomiting, and occasional blood count or liver test abnormalities have been reported, and with prolonged oral use a lupus-like syndrome can develop, though that is mainly a chronic therapy concern. In pregnancy, sudden maternal hypotension can lead to fetal distress, so fetal monitoring and gradual dosing are recommended when the drug is used obstetrically. Serious reactions should prompt immediate reassessment and supportive care. Next, important advices for using Apresoline Injection. Always check baseline blood pressure and heart rate before dosing. Give each intravenous bolus slowly while continuously monitoring vital signs, and be prepared to treat excessive hypotension or tachycardia. Use caution or avoid hydralazine in patients with coronary artery disease or significant aortic stenosis because reflex changes in heart rate or diastolic pressure can worsen ischemia. In obstetric use, give under specialist supervision with fetal monitoring and follow local obstetric hypertension protocols. Consider a short-acting beta blocker if reflex tachycardia is problematic and report and stop the drug for severe hypotension, chest pain, or signs of systemic hypersensitivity. Always individualize dosing and consult local guidelines when in doubt. Thanks for watching. If this helped you understand Apresoline Injection, please subscribe to MediInsights for clear medication guides and leave a comment with questions or topics you want next. Stay informed, stay safe, and ask your clinician if unsure today.